Can we start?
Yeah.
Okay, let's do it. Call the meeting to order. Roll call, please.
Director Correggio.
Here.
Director Delara.
Here.
Director Lofton. Is not here with us. Secretary Barraza. Here. Vice President Rodriguez. Here. And President Tucker.
Here. Will you please join me in the pledge of allegiance? Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. The items on the agenda that board members may want to pull.
I do. Usually we need to approve the agenda.
Let's approve the agenda first. So
So
a
moved.
little jet lag.
Second.
All in favor, please say aye.
Aye.
Opposed? Motion carried. At this time, we have public comment. Comments from the audience can be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Are there any public comments at this time?
There are none online. Are there any public? Oh, yes, we do have one online.
Please state your name.
This is Dr.
Carmela, you have the floor. Please announce yourself.
This is Dr. Carmela Meyer. Can you hear me? Can you hear me?
Yes, ma'am.
Okay, great. Thank you for giving me a chance to speak. I'd like to talk about the proposed agenda item regarding Desert Healthcare District's pursuit of ACGME sponsoring institution status. To begin, I'd like to offer some important context.
Carmela,
Yes.
excuse me. Let's take comment when we get to that particular item. This is for items that are not on the agenda.
I'm sorry.
That's okay, but we just ask you to raise your hand during that time.
Okay, I'll lower it by now.
Thank
Okay.
you.
Thank you, Andrea. No other public comment?
Any public comments for items not on the agenda?
All right, down to the consent agenda. Are there any items on the consent agenda board members that wish to pull?
I want to pull number 3 just for clarification.
Okay. Any other items? I have a motion to approve the consent agenda items except for item number 3. I make a motion.
Second.
All in favor, please say aye.
Aye.
Opposed? Motion carried. Item number 3, Las Palmas Medical Plaza.
So the reason why I pulled this is the way it's stated on the agenda, it makes it seem like we actually have a 12,185 monthly increase in extension, even though the documentation doesn't say that. I just wanted to ask for consideration that maybe in the future that it's be a little bit clearer, because it really is just a 3% increase, that it was originally 11,830 and now it's 12,185. So it's just an increase of 3%. So just for clarification, for public awareness, that we're not increasing it to 12,000. So with that, I will move it.
There's a second.
Second.
Any discussion? All in favor, please say aye.
Aye.
Opposed? Motion carried. We now have presentations from the Coachella Valley Economic Partnership.
All right. They said I could stand anywhere, but I want to look at all you nice faces up here. And so my name is David Robinson. I am the Director of Analytic Services for the Coachella Valley Economic Partnership, which I'll call CPEP from now on. Before I start, I just want to put a shout out to the staff at the district because we've been working very collaborative with them through this whole process, and they're a great team. And so I really appreciate Megan's been great. Everyone's just been great. Donna, everyone. So just want to put that out there so everybody knows. I usually like to do things a little extemporaneous, but there's lots of math and numbers in this. So I'm going to actually read this so I get this thing going because we get stuck in a lot of details. So we can get through this pretty quickly and then when you have questions. And the one thing I have to ask of the staff is, will this be available to the public at some point? Because there'll be a lot of things that people are going to see quickly that they'll probably want to look at in more detail later. Yeah. So, okay. So I'm very pleased to be representing CBEP to present our study findings for this. And I'm going to try to be, like I said, as concise as possible. So what we're going to go over today is we'll concentrate on how we use the Huron report to focus our study. Then I'll go over how we created our study methodology. Then we're going to take a quick look at the models that we had to build in order to come up with the estimates. And then we'll take a quick look at the overall results. And finally, I do computer mapping and stuff, and they asked me to do some mapping to look at some of the possibilities of making this report come to life. So if we've got time to do that, we'll go through that through the end. Okay, next slide. Yep. Okay, so several years ago, a group of staff from the district came to our office at CBEP, and they were really interested in exploring the economic outputs and the effects on the economy about gaps in healthcare. But it was a very broad idea of how we wanted to go throughout this. We discussed quantifying the effects of poor health on productivity, long-term wealth. They were really interested too about how the business community, since we're an economic development agency, feels about the lack of healthcare. So after a lot of discussions, we put together a tentative agreement at the end of 2023. We then proposed our proposal to the board and got a lot of really good feedback from that and worked from there. So with edits from the district staff and this board, they noted the proposed methodology was a little too broad and unwieldy. It's very hard to imagine trying to quantify the health effects of something like that in the economy. It's enormous, right? So after a meeting soon after, Donna Craig recommended that we focus the study around the recently completed Community Clinical and Social Needs Report that the Huron, which we'll now call the Huron Report from here on out, because they have some really good focus recommendations that we could use as a baseline for creating these economic effects. So that was the answer for where we go and to try to focus in on it. So, and one of the most important statements that popped out of me when I was putting the proposal together was they called for crafting a business case to provide targeted services, including gaps in healthcare. And I thought that was really interesting that it was a business case. So what will these targets be? We'll go to the next slide. And from the final recommendations, there were two specific goals that we used to focus our study on. One was we need more access to primary and specialty care services. And secondly, the second goal is that we need more community access to behavioral and mental health services. So from that, we'll go to the next slide. They came up with studying the current supply. Now this was, what would this be like 4 years ago or 3 years ago data at this point? Yeah. So of course these numbers have gone up since then, but we'll just use that as a baseline. They recommended, or they noticed that there was a 204 doctor supply of primary care doctors, 7 psychiatric doctors, and 84 surgery specialists. They then figured out the demand from time when those people would maybe retire, and then also the needs from population growing and things like that. And they came up with their gaps of targets for service, which comes up to a total of this 264. And you're going to notice later on that we've changed those numbers a little bit just to make the math easier. So we actually come up with 260, but you'll understand that when we get a little bit further into it. Okay. So we finally came up with an agreement and put the proposal together. And we decided to work with our team that we usually work with at CVEP, which is they have a very distinguished economics department at the Claremont McKenna College in Claremont. And Dr. Manfred Kyle, if any of you have been to any of our summits, he's a speaker and he also writes our summer reports, or he has for several years. We probably worked with him for about 8 or 9 years. So he was my first go-to to figure out that this is, you know, we don't do this kind of study. We don't have the skills or the staff and stuff to do this. So we needed to hire someone to work with us. And he recommended Dr. Darren Filson, who is an economics professor there. And he does a lot of these economic effect reports on lots of different industries. So he was really the person we wanted to work with. So with that, go to the next slide. All right, so the CMC team uses this technology and methodology called in-plan economic impact analysis. It's a methodology and also a software system that they use. And the most important thing about this is that that methodology makes use of modeling individual businesses, not individual occupations. So what we needed to do was, instead of just looking at bringing in so many surgeons, so many specialists, of course, those people have to have support services. They have to have staff. They have to have an office. They have to have all those kind of things. So we need to put together a model, if it's going to show the effects on the whole economy, what would actually an office of these people bring? Even if they joined another office, that's going to be more staff eventually they have to bring in. So start to think of this as a business of physicians, not just individual physicians. Because of course, and the other thing is they have to buy supplies, they have to, all that kind of stuff. I mean, you want to see how that churns through the local economy. All right. So what we did was we came up with 2 models of an office. Now, there are millions of different ways we could do this. And part of it was there are some just standard ones that they had in the in-plan software. And also one of the things that we did to prepare for this was we conducted 9 interviews with local healthcare leaders, some of whom are in this building right now, to familiarize ourselves with the local healthcare infrastructure and to get firsthand accounts of specific needs and challenges and things like that. So these 2 models really came out of those talks. And we're especially grateful to Jim Manja, who's the president and CEO of St. John's Community Health, who was actually just beginning to start their facility here. And he really knew the ins and outs of creating one of these offices. So he really helped us come up with these numbers. So our first model of 2 would be an office of 10 people that would include 2 physicians and 8 staff. Now, once again, we know this could all get mixed up in different ways, but that's what we needed to do in order to work with the in-plan model. And just note that since we have 3 different kinds of doctors that we wanted to bring into the physicians to bring into the Valley, that model could be useful for all 3 of these. Okay, the next one. The second model was the community health clinic model. And that's the all-inclusive model where people go to the dentist, they get all their healthcare in one place. That's the one that Jim really helped us get to know pretty well. And he helped develop this distribution of employees for a typical physician's office. So in this case, we've got 8 physicians and 40 staff. We just rounded up to 50 because we need even numbers to do the math in this. So notice then that for a office of 50, that includes 8 physicians. And notice that this will not be used for the psychiatric or surgical specialties, because usually those aren't in those community clinics. However, behavioral health things are starting to be brought into that too, but we were talking specifically about psychiatry here. All right. Go to the next slide. Okay. So what we need to talk about here, just briefly, is to talk about where am I in my list here? Okay, we need to look at the terminology that will be inside. Some of you won't be familiar with it. I wasn't. I had to learn all about this, but all of the numbers that come out of this study have different terminology associated with them, just so you'll know what all these numbers represent. We'll start with output, and that's the most common, easiest one for you to understand, because it's really about their revenue, right? It's all the money they bring in to run their office, right? So that would include the labor income that they're paying, everything else is all the output in there. But economists also like to do something called a value added number. And what that means is it's the output minus the revenue, right? It's the cost of doing business, supplies, consultants, lawyers, accountants. And the reason they do this is this office of physicians will contribute to the GDP, or the gross domestic product of the local economy. And they basically don't want to count things twice. So if you are buying supplies here, the people you buy them from are also counting that as their output. So you don't want to double count for things. So if I buy supplies at a health supply store and I spend $10,000 to do that for my office, they will also add that as their revenue that actually goes into the supply store will actually do that too. And it's basically counted twice. So you don't really have to worry too much about this, but it's just a way for us to take out the cost of doing the business afterwards. And then, that's it for that one, okay. And then we need to look at the ripple effects of having these physicians come into the economy. So for all output or revenue from business, there are, of course, ripple effects. And this is why the model separates direct, indirect, and induced cost that are economic impacts. The direct impacts are those only pertaining to the business itself. So the business directly employs 50 people. It generates this much labor income. It generates that much revenue. But of course, an office doesn't exist in a vacuum. It buys products, services locally to support its businesses. These are the indirect effects on the economy. The physician office buys supplies from a local business. That business in kind buys supplies locally, so on and so forth. So those are the indirect costs for that. And we'll notice that, we'll talk about it in a minute, but that just by bringing in 50 people, indirectly, you're having to hire 11 additional people to support that business and all the trickle down that goes with that. And then the induced effects are those produced by the actual employees that are affected in this model. So all 50 of these people do things in the economy. These indirect people do things in the economy. These people do, and that starts effect as well. So that's why they like to look at them in two different ways. All right. Okay, so now the next one is where the math comes in. So this is what we're doing is where the way that the implant system worked is they have, I should really read this because I'm going to forget all the distance, so go back to reading. So the implant methodology uses pre-packaged businesses that are customized for local conditions. The most important caveat about that is they are determined by the county they're in. Since we're in such a crazy large county that is adjacent to huge commute areas, like LA County, when we first ran the findings, they were really surprisingly low. And that's because the algorithm assumes that many of the indirect effects on the physician's office happen outside the local economy. So the idea is if you're in western Riverside County, half of your employees are living in Orange County or LA County, or you're going to LA County to buy your supplies. We're so far away from that, it didn't make sense to use that model. So he had to actually go in, write new code and make it work so that we assumed that at least 90% of all the effects from bringing in these doctors would happen locally here. So that really made the numbers much more realistic and impactful, I think. So also these prepackaged businesses come with certain size in the model. So even though we proposed a 10-person office for physicians, their modeling system starts with a 50-person office, right? So what we did was just put those 10 into a 50-person office. So to create a 50-person office with our 10-employee model of physician's office, we would need 5 of those to get the 10 doctors that we would need, right? So each 10 employee office provides 2 doctors. So a 50 employee office would employ 10 doctors or physicians and 40 staff, okay? All right, let's go to the next one. And actually, before I'll just finish from that last one. It brings an important note about this report. These numbers are meant to be multiplied or divided any way you want to. If we're going to bring in 700 doctors, you can multiply those different. You'll see an example of it in the actual written report, so that we don't have to just stick with this 260. Multipliers are easy to subtract and multiply. Okay, so you can go to the next. Oh, okay. Along with direct monetary economic effects of bridging the physician gaps, there are, of course, also tax effects, and we talk about that in the report. So a typical 50 employee, 10 physician office in the model would produce approximately $1.5 million in, I think it's the previous slide, sorry. Fast. Yep, $1.5 million in local, state, and federal taxes. In the next slide. What this slide does, and we have this for every model, we look at all the effects of the different modeling we did. The next one talks about which local industry sectors will most benefit from those indirect and induced costs that come from bringing in a new physician's office. Okay. The next one. So what we've done here then is we're going to be talking about adding these all together to get up at 260. So here are the impacts from the second model. This is the community health clinic. This 50-person clinic would provide 8 physicians and 42 staff. Of course, they also have tax effects that can be found in the report and local industries as well. The next one. Okay, so here we're going to see how we come up with those gaps and targets. So for a reminder, the Huron report estimated a gap of 181 primary physicians. To use our models more effectively, we rounded that down to 180. So to reach that 180 gap by providing 100 physicians in the physician's office model, we would have to add 10 offices of physicians, okay? Then we would then provide 80 physicians using the community health clinic model, meaning we would add another 10 community health clinics. So we come up with the next slide. So this is the total outcome of that. So to basically close this gap of 180, we would directly be employing 1,000 people, all those people supporting all these other primary care physicians. And then you can see the other effects of numbers. I'm not going to go through the numbers. You can look at them when you get the report, but you can see how that adds up to quite a significant number. Okay. Then we needed to model the psychiatric or behavioral health specialists and the surgery specialists. In this case, we just used the physician's office model. And so they were really looking to cover about an 83 person gap. And in order for us to make it simple for us, we just round that down to 80. So our report is slightly lower than it needs to be, but luckily the math works well. And in order to provide 80 physicians, where there's 10 physicians in each one of these offices, we would need 8 offices, right? And these are the effects of that. And then if you add all of them, you will see that the effects of bringing in and attracting this many physicians to the valley would bring in directly 1,400 jobs, that many in earnings, that much revenue, and then the ancillary effects of that as well. Next slide. And then, so if you add up the ancillary or induced indirect effects and the direct ones, you're looking at these kind of numbers to bring in that total of 260 physicians and all the people that are there to support them and all the people that are supported in the economy by having them and so on and so forth. Okay. Then what was fun about this was we also thought it would be a good idea to look at where some of these things could be, some of these, if the district were to support some of these clinics or offices of physicians as an incentive for doctors to come, where might they go? And so during the tenant lease purchase agreement, there's actually a document that I've redone here, but it's a map showing where the district is allowed to put in new facilities. So the hatched areas are areas that were agreed on with tenant that are outside of an area that's called a medically underserved area. I think is that a national designation? But it's a mapped area to show where they are. So anywhere that's kind of this orange color or the hatched color are places we could put house actually new physicians. Go to the next slide. So what I did here was, and these are in the report, they also in the Huron report recognize high-risk zip codes, places where people have high risks for being medically underserved. And so what I did was I picked 3 of those zip codes, proposed a place to put a clinic, did a 10-mile, 20-mile, and 30-mile drive time. So you can see it's kind of the impact of how many people would be impacted by each one of those. And when you do that, you can use those boundaries to figure out how many people you would serve within that community, what the annual growth rate is, what the median age of that area is, how high the Hispanic population, and what the household income breakdowns. And the reason why that's important is these are key indicators that the Huron report called out. We could see how they would compare with their recommendations. Okay, this is the final slide. What I did here was I combined all the 20-minute drive times into one big polygon and just looked at overall, if you had 3 new clinics and how many people, if you put those all together, how many people would that serve? It would serve a total population of 282,000, so well over half of the population. The annual growth rate would be much higher than it typically is in the rest of the county. The median age is quite low for our county. The Hispanic population is quite high, and there's a disproportionate number of people with household incomes less than $50,000 annually. So what we were hoping to do by that is to not only show that there's actually some power in how many people will be reached if we came up with some of the goals with Huron report, but we also hope that the report is kind of an incentive for the business community and cities and unincorporated areas to see what the effects on their local economy might be if they were to support the district's efforts to bring new physicians and especially healthcare providers to the area. All right. I know that was a lot. You have to look at the report and dig through it, but I just wanted you to hopefully get an overview of the methodology and the things that we chose to do in order to make this very complex report come to life.
Thank you. Questions from directors?
Go ahead.
Oh, you go ahead.
Okay, thanks. On the revenue numbers, is that accounting for our expenses taken out of that?
No, that's where that value added one, if you go back to like slide 4 or something. Keep going forward.
Down, thank you.
Oh, down, I mean, yeah. Yeah, so that would be like the revenue for a 50-person office. And then that's with all the.
Okay. And the only reason I say that goes to my next question is that it seems like there's an assumption that most of the supplies and stuff will be purchased within the area. I find that very hard to believe.
And honestly, this is great because there's so many different scenarios of this, and we would really love that impact, that response from people, because we would have an opportunity to tweak some of these numbers.
I mean, it's an opportunity to actually attract those type of industries to the valley. So
Right.
Potential economic growth.
Yeah,
And then
that's a good point.
my only other question, when you talk about the 50 community health clinics, are those FQHCs?
Yes.
And so then with that, within HRSA regulations, are we allowed to have that many more?
That's a good question. And I think that's the whole point of this. Is it's kind of like plug and play. Like you would just go to the max you would have there, and then you would have to look to the other model of just the physician's office.
And with that being said, though, is that if it's not allowable, though, is there's other options for community clinics, whether that's through Desert Regional or through Eisenhower. So it's in making up that difference. Okay,
I think so.
thank you.
Well, I think that's the thing to that point is I don't think they have to be all FQHCs.
I just don't think
Yeah.
correct. Is that I just don't think we would. I don't think we'd be able to have that many
Right.
because the
Yeah, and I-
common rules within Hearst.
And I don't think that's the recommendation here, but it's more about,
That was just clarification.
looking at what the clinics would look like potentially, financial, economic impact.
Director Delara?
Thank you. I don't know if there's actually a recommendation that's gonna come out of this, but I have 2 points. One is when you talked about the fact that this is a big county, there's also, we're a big hot area. Okay, so we're competing with a lot of communities that have much better climate than us, and we have great climate maybe 8 months out of the year. But, so that's what we're competing against. The map that you showed, perfect, this is the map that I was thinking of. When you see this layout, the underserved areas, unincorporated areas, the outer areas, those are the areas that lack infrastructure. So if you have 10 physicians that are looking to set up a practice, they're not going to find a place that's already built. And it takes a lot, having been in this area and in trying to encourage housing in some of these areas, taking more than a decade to actually produce any housing in one. So that, I think, has been kind of glossed over a little bit, that there's, if you want to look at the lack of physicians and growing physicians and putting them out there, you also have to look at growing the facilities, bringing in the infrastructure to actually attract the physicians to go into those communities. So that's 2 points. Thank you.
Yeah, and it's a good one. I think hopefully a model like this could also show the community, if you make that investment.
This is a good start. I really good information, a lot of food for thought. Thank you.
Great.
Director Shore?
Sir, the algorithms, the computation of financial costs, et cetera, is silent on the cost of acquisition.
It is.
Totally silent.
Yeah.
What does it cost to acquire a doctor, just to pick
Yeah.
one element in the entire universe of everything you're talking about? So how do you plan to adjust for that, or how do you expect us to adjust for that so that if and when it goes forward, there's a funding source?
Well, I think that would be the job of another report, because what we did not look at costs here. We just looked at the economic output or what would come from it. That's.
Thank you.
I get it, but yeah, that's exactly true.
And if I may, the timing of this report, I think, is important with our upcoming strategic planning process. Because I do believe during that process, we're going to be looking at 2027, what options that we have as a district to assist with putting facilities into those types of underserved areas. And this is just a model of looking at, okay, if that does come to pass, and there are those facilities and the infrastructure cost and bringing in the doctors, well, this was just an effort to look at what could potentially be the economic impact of using that Huron report. Now, how realistic is it? There's variables. There's the heat factor. I think that's part of the challenge that's always going to be is how do we attract the medical providers? But this was an effort to look at the economic impact if something like this could be developed.
Yeah, I would just follow up on what Dr. Delara says, that I think it would be interesting to have another study done to see what's the cost to actually bring that infrastructure in and to acquire. I get this report, and I really that this is the actual economic impact if that was all in place. But to Letty's point, work for the county, and part of my job is in development. So the East Valley is, extremely under infrastructured. And so that's going to be a huge heavy lot. And that to me is where the biggest need is. And will be the fastest growing part of the county as we go over the next 10 to 20 years. So.
Right. And go ahead.
Just as a follow-up in what you said before about demonstrating the economic possibilities here and working with others to be able to make something happen. I think that is the key, is that we can't do it all. We have limited resources and we have to be part of a greater effort. When we look at creating multi-use projects, that you have to think about partnering with school districts or with a developer that wants to bring in a multi-housing project. Those are the things that will make something like this happen, to be able to have a component of healthcare be part of that. Because it may seem like if we have funds to start something like this, it's not enough.
Right. Very well stated. I know that if Kay Hazen were here, she'd say, well, you gave us the what, but not the how. And in some of your report, you stated that the expansion requires construction of new healthcare facilities or renovation. And that's something that we need to put on our plate. And also, I know I had a discussion with some of the management at Desert Regional, and they do have the ability to subsidize practices for new physicians coming into the community, but it only goes to a certain point. So to your point, that there's, a way that maybe there's some partnerships out there. We have existing federal qualified health centers that may want to partner with us to build in some of the areas that are outlined there. So, and I love some of your additions about attracting medical personnel. That we have a problem with the high cost of living here in this valley, including housing. We need localized training. We do have College of the Desert as our partners and UC San Bernardino help pay student loans, help pay medical school loans, create a medical recruitment agency. These are all parts of the things that, will go into our long-range planning. So, this is a good start, and I appreciate that. Are there any comments from those who are joining us that you'd like to say? Go ahead, please introduce yourself.
Carlos Garcia from Garcia Research. My question is, can you project the value added of a healthier workforce?
Well, that's always with that. I don't know. That's a
People are not sick, the kids are going to school, the parents are working.
Yeah.
It has this dramatic impact on their total economy.
Yeah, and the problem was that was what we first started with, and then we went to CMC and they looked through all the peer review research, and it's really, really hard to do that because there's just so many different effects that go into that. They just were uncomfortable to make that kind of. That doesn't mean it can't be done, but it's not easy.
Any comments? Great, thank you so much for your presentation.
I didn't see you.
Next, let's go to G on the agenda, strategic grant funding actions. Let's go to number 1, grant 149C, Cal State University San Bernardino, Foundation, Desert Campus. Staff, would you like to read this?
This is continued funding for continuing the nursing student street medicine program. And the use of funds will be paying for some faculty, nursing faculty. And it was brought forward to the program committee, and the program committee recommended board approve this grant. Everybody's here from Cal State.
Are there any comments from those in attendance? Any comments from the board? I know that we had
Michelle Skeechan, I'm saying her name right, I apologize, is here from Cal State. If anybody has any questions. Grant.
Move approval.
A second.
roll call, please.
Director Perezkill,
Yes.
Director Shore,
Yes.
Director DeLauro,
Yes.
Secretary Baraza,
Yes.
Vice President Rodriguez.
Yes.
And President Rogers.
Yes. Okay, number two, Grant 1498, Variety Children's Charities of the Desert. Yeah. Staff,
This grant is going to cover increased staffing in their satellite offices in Mecca and Desert Hot Springs for services for children and families. And the funds are specifically going to support the salaries of backup program specialists, DHS program specialist, program coordinator, and program manager. And program committee also recommended moving this to the board for approval.
any comments from those in attendance?
Heidi is here. She's the executive director. If anybody has any questions.
Any comments from?
I don't have any questions, but I do have a comment. I was really impressed with that the company just operated within Palm Desert and that the expansion of this into Mecca and Desert Hot Springs, two of our most medically underserved areas, was really, really appealing. So with that, I move approval.
It's seconded. The only comment I would have is that I would like to see some information about their clinics that we could disseminate to the public as board members. Roll call, please. Oh, yes.
So a quick question, John, if this was the numerator of a fraction and the bottom of the fraction was their functional budget, what would be the relationship between the value of the grant versus their current operating budget, roughly?
That's right. So their total project budget is about 579,000, and what they're asking from us is 175, so.
It's about 20%,
25%?
roughly 20,
Okay.
that's actually 19.67%.
Great.
Thank you.
Any other comments? Roll call, please.
Director Perezkill. Yes. Director Shore.
Yes.
Director DeLauro,
Yes.
Secretary Baraza,
Yes.
Vice President Rodriguez, and President Rogers.
Yes. On to strategic grant funding, item number 3, grant 1501, One Future Coachella Valley. Building a healthy healthcare workforce pipeline. Staff comment?
This is a two-year grant that is going to be continuing scholarships to the Black and African American students that are pursuing a career in healthcare, as well as graduate students and other undergraduate students all pursuing a career in healthcare. Program committee did move approval for this, and Sheila Thornton is here, and we also did want to just share with you a little video from one of our recipients.
Hi, my name is Kyra Holland, and I'm currently a undergraduate freshman at Seattle University, located in Seattle, Washington, and my major is nursing, and I'm supposed to graduate in the spring of 2028, so we'll see how that goes. But I'm connected to the Valley because I just graduated from Rancho Mirage High School in 2024. So that was awesome. And I've lived in the Valley my entire life. It's my home. It's what I know. I appreciate it so much. And I really do love the Coachella Valley. I think it's a growing city. I think it's a growing pool of people. I think it has a lot of opportunity, and I really enjoy it. So there's that. I've been with One Future for around a year now. I've experienced their Black nursing scholarship this year, which has been the greatest blessing I've ever received in my life. It's so good. It has helped me financially, mentally, emotionally. I feel way more motivated to continue through school because I'm not weighed down by my, financial discrepancies. I can really just focus on school because I know that I have that scholarship and the support from One Future, not only financially, but like with mentoring, with academics. Like One Future is a holistic program that doesn't just give you money and is just like figure it out. I love that I have to like meet with people and talk to them and check in, and I think it's a really, really great program. So I'm very, very appreciative to be able to be like a part of that. So thank you. I also want to shout out Yvonne Henderson. She's the career counseling kind of guide at Rancho Mirage High School. And if it wasn't for her, I wouldn't have even applied to One Future. I didn't know about it until I'd spoken to her. So I want to thank her for nudging me in that direction, because now it's just been just a like spiral effect of great things happening with One Future. So thank you, Miss Henderson, for pushing me in that direction and for shouting out One Future and just kind of exposing me to what they're about and like their journey. So thank you. My academic and professional experiences, right now I'm supposed to be doing an internship in Seattle for a little bit during the summer, a nursing kind of emerging thing. Yeah, just because I'm prepping to be a nurse tech. So I'm super excited for that. I'm currently in a health club at Seattle U as well. I just do like little lab experiments and learn more about the body. It's really just an extension of what I do in like my anatomy and physiology classes, but like for fun. So I love to get as much experience as I can. I'm very serious about the healthcare field. So I'm super, super excited to delve into that. Next year, I'm also supposed to be a residence assistant, an RA at my school. So I'm super, super excited because I love to connect with people, and I also just kind of want to be a guiding figure to any freshmen or to any transfer students who don't really know the campus as well. I feel like that's something that I would want and something that I would need. So I'm super excited to do that as well, and to meet new people and to just have a great time at my school. My future goals is after I graduate from Seattle University, I plan to go back to the Valley and work at either Eisenhower or Desert Regional for a year and a half, because I just kind of want to bring what I've learned from Seattle from a different place back down to my home and get reconnected and kind of ground myself before I go on to move again, and to, I just want to go back to the Valley to ground myself and get my things together and practice nursing in the place that I feel most comfortable in. And then after that, after I get my year and a half experience, I plan to become a travel nurse for a couple years. And then after travel nursing, I'm going to kind of take a break, go back to school, and then get my nurse practitioner degree. I want to be an NP. That's kind of how I see myself. I want to be a higher level nurse. I love the just flexibility that nurse practitioners have, and I just feel like it's a position that I would really, really enjoy. So lastly, I want to thank the Desert Healthcare District for their funding and support. I really, really appreciate it. Not only do I appreciate it, and I've been receiving it, so thank you. I also know that One Future appreciates it, and they also appreciate you donating not only your time but your money, and just really making sure that people are able to go to school, especially nurses, because we need them. So thank you from the bottom of my heart. I really, really appreciate it. And then I also want to thank the advisory committee for donating their time and expertise to guide our BAA initiative. Thank you so much. And yeah, thank you guys for having me, and have a great day. Thank you.
Awesome. Looks like we're going to have a great nurse in the Valley. Love it.
Not enough energy.
So program committee also recommended moving approval of this grant to board.
So are there any comments from those in attendance?
We'll take her, we'll hire
Well,
her.
then it's for longer than a year and a half.
We'll
We can
take
help
her.
her get in school while she's here. That's the idea.
That's great. Any comments from directors? Yes, Dr.
Kind of in line with what the question that Director Shore had earlier. I was just very interested when I saw this, that the 1.87 that for the program cost, that the ask is 839. But when you really look at it, when you break it down, that direct costs are very high. So the only indirect cost is 109,500. So we're trusting an organization to do what they're doing, and that know how to do it, and for them to do it at a very low cost to us. So continue to do that work. I appreciate everything that you're doing and to produce. quality people. I just wish that we could keep them beyond the year and a half, and hopefully we will. Hopefully we can draw her in and have her start a family here. But just want to point that out. Great program and the way it's run. So that's it. And I do move approval.
I'll second.
Any comment?
I want to say that I saw One Future in its early inception, and it's just been amazing to see the progress. And I think for a district to invest in this, in the quality work that you all do, and not only recruiting students, but actually bringing them back to the Valley, I just applaud that so wholeheartedly. Support this.
May I make one comment that I didn't say?
No, please.
Thank you very much for those comments.
Please introduce
My name
yourself.
is Sheila Thornton and I'm the CEO of One Future Coachella Valley. And I just thinking about the economic impact that David shared, the sort of flip side to recruiting is what we're trying to do growing from within. And just this morning, yesterday got a text from a student who was trying to match. She's in medical school. She was trying to match for a residency here, but she got matched in San Diego. But her intent is to come back here. So we've been scholarshiping her for probably 10 years by now, and we would love, the whole idea here is to do everything we can collectively to bring them back. The other thing I want to say was that this work has attracted dollars locally, in-state, locally, but from local philanthropy, there are two donor couple that had started what's called the $1 Million Healthcare Workforce Fund 5-6 years ago. And they are just so excited to know that Desert Healthcare District has continued to support this. But we also just this year got the Houston Family Foundation to commit to 3 years and to be sort of a co-partner with Desert Healthcare District and the other funders. So it's attracting that kind of local investment. And then this year, the Carnegie Corporation, who gave us an award, is considering putting scholarships into a new grant for us. So that's in large part due to the kinds of action that's happening.
Thank you, Sheila.
Director, President Rogers. Sheila, how much is the Houston Foundation giving?
They committed 3 years at $400,000 a year, $250,000 in scholarships. And they really wanted to know what's our greatest need. Our greatest need is multi-year so that we can have continuity for the students. Because if we're doing it year over year, you're sort of playing with blocks of funding and you can't make them up the longer term commitment. So they bought onto that. You know, there are deliverables associated with it, but they also agreed that they could be named as a champion for the Health Workforce Fund as a local philanthropic foundation that's challenging others to do the same.
That's a significant amount for private foundations.
Yes.
Great job. Thank you.
And I think it's our strength as a district in combining our efforts with other foundations in the Valley. Excuse me, something that we can look forward to in the future. I also wanted to point out that our student nurse mentioned that she said, thank you for your money. And I want to remind that this is taxpayer money that we're providing, and doesn't come out of our personal pocket. We are stewards of our tax dollars, and this is a wonderful way to spend it. We have a first and a second. May we have a roll call?
Director Perezquio.
Yes.
Director Shore.
Yes.
Director Delara.
Yes.
Secretary Raza. Vice President Rodriguez.
Yes.
And President Rogers.
Yes. Moving on to reports. Desert Medical Center CEO report, I believe. Mr. Vitaro is here.
Yes. Well, it's difficult to follow that young lady that we would certainly like. We also donate a lot of money to One Future as well to help double that nursing workforce. We all want to hire all of them as well. So we continue to be active in the community with our physicians and various events. We had the opportunity to present at One Palm Springs, which is a group of the neighborhoods in Palm Springs, to highlight all of the key services that we have here in the Valley in our mission to provide that advanced care close to home. We participated in the annual telethon with the Fine Food Bank, many health fairs. We celebrated Doctors Day this past month and gave them some nice Desert Regional Medical Center jackets. Our physicians were in the media a lot of earned media, educating on various health topics. We prepared extensively for the music festivals that we've had the past 2 weekends, including the upcoming one, including working with our county, bringing in additional staff, and our MICM nurses to help triage, God forbid anything happened. We like to be prepared for that type of thing. We also had the opportunity to participate with the 29 Palms Air Force Base in what was called the Mojave Healthcare Symposium. And that included the military, various tribal organizations, all the way out in the geography out to the Colorado River and how we would prepare for various scenarios. Unfortunately, our participation got cut short when we had that earthquake a couple weeks ago. So our person attending had to step out for about an hour and a half while we made sure everything was functioning in the hospital. And pleased to report, everything was fine in the hospital. We had no interruption for that. But we do take the emergency preparedness seriously, and it's something we certainly focus on. And then finally, we've been reporting on some of our capital and construction projects, and we're getting excited that we are nearing the beginning of some of these. A lot of time is spent as we do the required architectural and engineering studies that we submit to HCI for ultimate approval. We have a start date on our elevator projects to replace the first 8 elevators in the system that we plan on replacing, or in the hospital that we plan on replacing. That's going to be, I believe, on May 19th. We are hopeful our kitchen and cafeteria project will also begin in May. It may move to June, but those are a couple of big investments we're making. So we're excited for that. That's my report.
Thank you. Any comment? Go ahead, Director Navarro.
2. One is, on the services, events, media, you mentioned that you've had some programs. The one that caught my attention is the cannabis used by youth in the community. I'm hoping we can get a little bit more, maybe we could help you to share that information with more, because I think that that's something that we need to be very concerned about. The district has taken an interest on the fentanyl use, and so maybe this is something that the board might want to have a little bit more conversation about. But I think that our schools having youth start with cannabis at younger and younger age is pretty scary. So that's one thing that caught my attention. The other is the kitchen and cafeteria equipment upgrades. I was just wondering, since that has been an issue that has been brought forward to the board in the past, can you share in the future, maybe bring us a layout? I know you don't have to get our okay and that you've, but can you just share with us so that we could be excited for the project instead of just seeing it written down? Be excited and be interested.
We're excited, yes.
I know,
We
but
can get, so
excited for it.
to give the details, we are replacing the entirety of the equipment in the cafeteria and in the kitchen. So all of those lines are going to be taken out. And I think I may have described it here before. You know, if you think of the kitchen, the line in our actual kitchen where we make all of the patient preparation, there's probably from the end of this TV, maybe almost to the end of the room, a line of equipment that's all connected. It's really hard to get behind and clean. We're going to be replacing it all with modular pieces of equipment. We can move in and out, do the flooring all around that. And then prior to doing that, we are replacing everything in our cafeteria. And so we'll get that replaced. So we have to close the cafeteria to visitors and the staff. When the cafeteria is done, we're going to be moving our patient food production upstairs. So because we can't interrupt that while we do the main kitchen, and then we'll be excited to do the grand opening of the cafeteria for our staff again and for visitors. But
So
yeah,
if you could just share with us, maybe at the next meeting, so just tell us how much you're spending, how much you're investing in the improvement of the facility and what's it gonna look like? Because I think that's something that the community would be very happy to hear, that there's great investment and great, it's just, I appreciate the update, but if you could just help us visualize it a little bit better.
sure, we've got a
Thank
couple
you.
other exciting things that we'll
Yeah.
be talking about in the coming months too.
Yeah, the cannabis thing is very important.
Any other comment, question? I had one, Mike. I know that when Measure AA passed, Desert Regional committed to earthquake retrofit. Are there any forward progress on those plans?
We are in the process with the architects and the engineers. The next deadline is January 1 of 2026, where we need to submit all of our plans on how we do all that retrofit. So there's been work going on now up to geological studies that need to happen around the site. They've had various small drones flying over to complete some of the things that they need to with regards to the topography of the campus. So that work is underway and we are on track to hit the target for the submission come January 1.
Thank you. Any other questions? Go ahead, Alejandro.
Mike, I just want to give you and the staff a quick shout out at Nick for the NICU. My child was born and he spent 3 weeks there. And the staff was just amazing.
God bless.
From the cuddler program, which is volunteers that come and cuddle the babies that don't have visitors. To the breast milk donation program that we took advantage of while mommy started producing her own milk. The staff was just amazing. We participated in rounds every morning, and not only was it very comforting for us, but just the level of education of all the beeps and the sounds and all the little charts and all the things that he was hooked up to was just amazing.
What's the young guy's name?
Joaquin.
Yeah. So in 30 years, when we have our NICU reunion, because we just had a NICU reunion last month and you didn't get to hear me talk about it. We had a 30-year-old who was alumni of the NICU who went there. She had great care. She got to meet the nurse practitioner that cared for her when she was a little one. And she had a 10% chance to live, and amazing work, and thought the little guy's doing well.
Great story.
Joaquin arrived the day after the reunion.
He did, yeah.
Decided to come
I
join
still
us.
talk somebody who wanted to see all that stuff there, yeah, but the staff was just amazing, you know, it's all the way from postpartum, all the way to the NICU, and we would call at random hours, they would pick up the phone, give us updates, and just, like I said, it not only was it very comforting, but very educational for us to know exactly what was happening. The attending physician would come over and talk to us, the nurse practitioner at night, we were there, 6 times a day, and it was very, very good experience for us.
Well, thank you for trusting us with your little one. It all went well.
You need Alejandro in a commercial.
Take him up on that.
I would love to.
And I don't know about you, but I think Pappy Alejandro has a different look about him.
So true.
It's amazing. Yeah.
Yes, congratulations.
Great experience.
Congratulations, Alejandro. Any more questions? Any questions, comments from those in attendance?
I have a comment.
Go ahead.
I failed to mention the contribution from Desert Regional Desert Care Network to the pipeline, $1.8 million this last year. So we're very grateful for that. And they're very close partners on that front. So
Well, we
That was
believe in it,
great.
our workforce is our most important asset.
Yeah.
So, we want to develop them and keep them here.
Thank you, Mike.
Of course.
Yeah, and recognizing that this funding is a continuation of that workforce roundtable that, we've been a part of and was honored at not only your organizational annual event, but the College of the Desert. And so it's a great working environment with those community organizations that we're all involved with. So.
Thank you. Next, report from Desert Regional Medical Center Governing Board.
Yeah, the report's in the packet. The only thing I'd highlight is, I really like Mike's move now to really highlight within each board meeting, a specialty or a group within the staff that really gives you a little bit more in-depth view on the activities of the hospital. So really appreciate the direction you put on that. Happy to take any questions.
Any questions from the board? Any questions from those in attendance? Okay, we'll move on to Desert Healthcare District CEO report.
Thank you, President Rogers. The first item on the agenda is with regard to the healthcare district considering to do a institutional or a sponsoring institution for a residency program. If you recall, about a year ago or so, the district completed a feasibility study with Partners in Medical Education as to what a residency program could look like for the healthcare district. And at the time, we were in the midst of lease negotiations, et cetera. We didn't know at that time if we'd be operating the hospital or not. And at this point, we do know that we are continuing with a long-term lease and transfer of the hospital. And so there will be economic resources that will be coming to us over the course of many years. And so as we're planning for our strategic planning process, staff has looked at opportunity for the district board then to consider if a residency program is something that they would like to do in our long-term planning. So we have internally applied with a letter of intent, which determines that the healthcare district can be a sponsoring institution. We are at this point looking for direction from the board to continue with an application for sponsoring institution accreditation, which would allow the board then, as they're planning for the future, to consider residency programs as the healthcare district being the overarching organization across the entire district to be able to help work with other organizations in developing and building out a residency program with multi-programs that could be developed underneath that overarching sponsoring institution. So what we'd be looking at from the board is consideration for the district to go ahead and apply for the accreditation. The district does not have to incur any expense until after the accreditation is either approved or rejected, assuming that we would be approved. Then there would be a $10,000 fee if we choose to accept that. And then we do have a 2-year period to then be able to develop out any programs and start any programs within that sponsoring application. We have been working with as a expert, material expert, Dr. Kim's to apply for the intent letter that was submitted to give us approval from ACGME. And so we would like to continue with the application for accreditation at this point.
Director, comments?
I just have a question. I'm fundamentally supportive of collaboration, let alone education. But what role specifically would we play as an overarching agency with working with organizations that would be effectively discharging their responsibilities?
So how the district would play into this is that, I mean, if you think about the district as a broad, large area. So we're the stewards of taxpayer dollars that would go to help support advancing and building out residency programs across the entire district. And so we would then be able to partner with organizations to help build out those programs. So the district would be the overarching. There would be staff that would need to be hired internally to oversee that. There would be designated institutional officers. There would be program directors, et cetera, to help build out those programs. So we can partner with organizations like the hospitals and FQHCs and be able to help build out a larger program across the entire district. So that's the benefit of the healthcare district becoming that overarching sponsoring institution.
Go ahead, Director Barraza.
You can call me Dr. Vita. One day. All right, thank you. I do want to say thank you for bringing this up again. Like Arthur mentioned, I think that this would be great. But I think we're getting a little ahead of ourselves. I appreciate the leadership. I was a little concerned that there was a letter of intent submitted when we had tabled this item and that the board wasn't notified that that was going to be the case. Which happened, it's okay. But I would like to know So if we were to submit the application, do we have the supporting staff to do that at the moment? Like, are we there? Like, would we be able to submit an application and be able to track that and work on it?
We do have the support available from the Doctors Kins to be able to complete this application with their expertise and be able to apply for that accreditation. And the reason that we applied with the letter of intent, because there were comments and concerns made from, a year or so ago with some board members when we were tabling this for the time, whether the healthcare district could even be considered as a sponsoring institution. So staff doing some legwork then to be able to determine if we could even communicate with the board that we could apply as a sponsoring institution. We felt that, there wasn't any cost to it. It allowed us to then determine and be able to provide quality information to the board that would indicate that we are able to apply for the accreditation step. So,
And I gave approval to staff to do that.
yeah, and we spoke with, Director President Rogers and that, and so
This information on.
but what we wanted to do with this then is at least knowing that we can apply is looking for direction at this point. There's no cost to it. There's the choice then for the directors to decide if they want to accept after we've determined if we're approved for the accreditation. And it's perfect timing for it as I see it, for then the board to be able to incorporate this topic into your planning process over the next several months.
I have another question.
Does this require an action?
No.
I have,
Direction.
so let's say that we do apply and we are approved. Guide us through the next 2 steps, 2 years. You're saying we would have 2 years to implement a program that would be like generating a program from the ground. Would that give us enough time to do so? I mean, we all know things can run a little bit slow. I'm thinking we would actually need to finalize a partner. We know that we've talked about potential partners or those that have stepped up or that we've asked and that are helping. I think some of those decisions should be made by the board when we do move forward. But I would like to see maybe a plan, or if you can run us through, in your opinion or from your knowledge, what are going to be the steps? What are we going to do within those 2 years? I would hate for us to do all this and then get to the 2-year period and for us not to be able to deliver. I know that you've mentioned, well, that would only mean that we won't pay the $10,000. I don't think that's what should be the deciding factor. I think I want to make sure that we're the most ready for when those 2-year periods, the 2-year period does begin, and we were to be approved, that we're actually like ready to hit the ground running, that we're not going to be spending time, as we know, right? Like if we're going to hire folks, like there's a whole process of like onboarding, finding the right folks, making sure that the program is going to be like beneficial to the district. I think that's more than anything, the district, the people that we're serving. I don't want us to rush through something just to see if we're gonna get approved. I want to make sure that if we're gonna work with staff, the district's gonna invest any time, resources, that we're the most prepared to be able to be successful at this. I would also like to see like what are going to be more like direct benefits of the district running this program. Financial fee, like other benefits, it's just running the program. I know you mentioned collaboration amongst stakeholders in the district. I think those are things that we do engage in, and that if we are going to focus on something like this, I would like to see like workshops. I would actually like to see stakeholder meetings. I would like to hear from our constituents. I'm assuming this would be pretty costly. We're talking about hiring more staff. It's a commitment, right? It's more than like a 2-year commitment, 10 years. It's a very heavy commitment. that I would like to see a little bit more information, or would like to be able to visualize it before making a recommendation to move forward.
And thank you for those questions. So they're good questions. And, you know, the vision here is not to have been all the way through what you're talking about. It, at this point, it is a building process, and it does require, if the district cannot be approved as an accreditation sponsoring institution, then we know the answer, we can't go forward. What this does is allows us a step in the process to be able to bring to the board the opportunity, especially as we're doing our strategic planning, to discuss this as an opportunity going forward. If it's an item that's important to the directors going forward, then we have that application approved by ACGME and allows the board to consider that going forward. And we would continue then if in our communications through strategic planning, we can then develop more of that you're talking about. But as I envision it, with the healthcare district being the overarching organization as the sponsoring institution, then we can work with partners in the community, hospitals, FQHCs, and we as a sponsoring institution can have benefit of being able to apply for the funding that can help offset some of our costs, like Song Brown grants and other CME fundings, et cetera, that could be negotiated with the hospitals, et cetera, to help support our expenses. So
I have another question. How many other, this is not going to supersede other GME programs in the region, will it?
it's not going to supersede, it's going to help enhance
Are we
those.
going to be enhancing them, or are we going to be competing against them?
I don't see it as competing. I see it as the district being the sponsoring institution, that then we work with the partners, the FQHCs, et cetera, other organizations to help them build out those programs. Because we're going to be, I assume, if the board approves to go this direction, we're going to be providing funding opportunities or considering funding opportunities for those organizations that are wanting to do residency programs. So the benefit here is the district isn't overarching for the entire district. If other organizations are coming to us looking for funding resources, they potentially are looking just at their own location or own area, and that's limiting. If the district is the overarching sponsoring institution, we can work with those organizations to develop their plan in those areas, their program in those areas. But then we've got the support to help build out a network for the district area.
What would be the cost to implement this?
That,
We have an estimate, a rough estimate, at least, like how much we have to.
if you were to have looked at the feasibility study, it's in the packet. I'd have to go to the numbers, but there is.
Can you pull them up? Just because if I didn't
Sure.
identify it, take a
Absolutely.
look at that. And then also see,
And this comes from the feasibility study that done. Gotta go back.
when we look for that, then if I'm understanding correctly, with the letter of intent that was already approved, that's telling us that the district can be.
Can be a sponsoring institution.
That's already telling us that we can.
Yeah.
Are there annual, like?
No,
It needs to be,
Oh, excuse me, point of order, ma'am.
sorry.
is there a deadline, like, this application needs to be submitted by a certain date? Like
The-
one?
The next date to apply for the accreditation is May 12th, but there's future dates as well.
Mhm.
But we're,
Do you know for them to give us, like if we were to apply, like how soon would we know?
My understanding, it's within a couple of days that they give acknowledgement. After
Couple of
that date.
days, like they would give us if they were to give us the approval, and then the 2-year mark, the clock would start ticking.
If we accept that approval and pay the 10,000, then my understanding is then the clock would start ticking on the 2 years. But my understanding is the 2 years then can be adjusted if we're, working on a plan or program, but those deals can be, worked out, and we bring more details to the process. What we're looking at here is the direction to be able to put us in a position to allow the directors to choose on what we do going forward.
Again, like to recap, I think this is something very worth to looking into, but we need to make sure that one, it is something that's feasible for the district. I see it as, we're adopting a baby, right? Like it's gonna be like a full-time, full-on commitment, which I think it's worth taking a look at. But we also need to consider, are we gonna be benefiting the community? Are we gonna be affecting other programs? How burdensome or not? I think there's still a lot that needs to get done, or that we need more information even before we submit an application. If this application and we're able to submit it, there's a deadline coming up next month. I don't see the urgency of us trying to rush it and get it through May 12th. I think that I would like to see a little bit more information. I would like to see an outline. I would like to see, I understand that we might not want to invest in a full-on report on exactly how it's gonna look, but I think even just more information on specifically how it would work for our district before, in my opinion, or personally, before making an actual recommendation to move forward. When you talk about the strategic plan, yes, it's good. Now we know that we can actually run it. I don't see the difference. I don't see how we're trying to rush and try to get something completed within 2 years and maybe not be as successful as we should be, or as we can, if we take our time and actually work on this and before we actually submit an application. And then one last question, I know that we can now, are there other healthcare districts that are running as sponsors in the state of California that you might know of, Jeff?
Not that I'm aware of, it's Section P hospitals that are doing this. This is out of the box.
We have Director
also
Laura.
Yes. I can't promise I won't have other questions. Just kidding.
Okay, so I do remember that board meeting, maybe not 100%, but we decided at that time that whether the window was closing or not, that we were not in the position to decide yes or no. If we lost that opportunity, so be it. We are now in the process of starting a strategic plan, planning the strategic plan. Why would we go into such a major commitment now before we go into the strategic plan and decide whether we want to do this or not? I understand your reasoning, but I don't understand why the president even said yes to send the letter of intent based on that board meeting. There was no consensus to support this. And so here we are. And I've been asked by other community members, I think you were in the presence of one of those conversations, Chris, can we apply for this money? I can't remember what it was. And my response is, you can apply all you want, but if you're based on the strategic plan that we have now, okay, we have the obligation to listen to our community, but it's based on the strategic plan that we have now. Until we do the new strategic plan and we incorporate and adopt that strategic plan, that's what we're going to be basing on whatever number of years we have. So I think we're going backwards, and we commit to something, and you're saying, oh, this isn't costing us anything. But how much time have you already put into this? And what is the perception that we're giving, that we're gonna do this, and if you tell us yes, but we're now in the position to be able to go forward? Why can't we just wait until we decide on the strategic plan and decide whether we want to do this or not? We waited a year. We could wait another year. If this is a major commitment to hire that many people, that expertise, to get us involved in something that we don't know what is going to be the full build out. I know that when we've been involved with residencies programs just by another agency taking care of this, there's a lot of drama, a lot of expense. I don't know if that's something that the district wants to get into. So let the directors hear what the community wants. Let's go through the strategic plan. Let's decide proactively, what do we want to do? Do we want to invest in future doctors like this system? It's a system. It's a major commitment. Or do we want to invest in other things? Do we want to invest in One Future Coachella Valley? Doing what they're doing. They're the experts. Do we want to invest in infrastructure? I know I have some ideas, and those things, I don't know if there's a majority that would support it. If they don't, then okay, we move on to the next thing. But I'm not going to be acting on something just based on my opinion. I am 1 out of 7, and I don't have more voice than anybody else here. So I don't think that we should be going into this without understanding what is the majority of the board interested in for the best interest of the community. There's only so much money we have. It's not going to be enough to do so many things. How do we prioritize what is the needs of the community? So I am not in favor of this at this time. I may be in favor of it in the future, but not at this time, not doing it this way.
Any other director comments?
I'd actually like to, I think, make public comments, which I'd like to hear before.
Yeah, that's what I was gonna.
Yeah, that's definitely on the agenda. So I understand there's somebody online that would like to make.
There is. Do we want to start with those that are in person first?
Sure.
Ronald would like.
Yeah, also.
No, I will give my time.
Okay. Okay, Carmela, you have the floor.
Okay, thank you. I'm so sorry. I'd like to apologize to the board. I didn't realize I was not unmuted and I was yelling at my dog. I'm so sorry. So I apologize for that. But I do want to clarify some information. So about the letter of intent. The letter of intent is not a request for approval. Yes, ma'am.
Could she identify herself?
Please identify the agency that you're with and your role with the agency.
I'm so sorry. I'm Dr. Carmela Meyer. I am the consultant, the GME consultant that developed the feasibility study. I am with Partners in Medical Education. I've been involved in graduate medical education for 30 years. I've been an associate program director, a DIO, which is in charge of the entire GME. I've been a network director for GME. So I have a lot of experience both managing and establishing new GME programs. So about the letter of intent, it is just a letter that opens up the database so that you can then do the application. It does not give you any assurance that you would be qualified or approved. It doesn't do any of that. It is no quality indicator. So the letter of intent doesn't let you know that you are going to be, or you have the qualifications to be a sponsoring institution. That's first. Second of all, there is no, Mr. Christensen was correct. There's no ACGME fees associated with establishing a sponsoring institution. However, there are significant fees when you look at physician time and staff time. In addition to that time, you have to build a GME committee, which is a committee with set membership that has to be a part of the GME, and they have to meet on a regular basis. They make decisions about the GME program, and the two roles that the GMEC plays is they provide oversight to ensure significant compliance with ACGME requirements. The other thing is one of the responsibilities of the GMEC is to ensure the financial stability of a GME program. And I'm terribly sorry if you hear my dogs barking. But you have to ensure the financial stability and resources to be available for the residency programs. The 2 years is not a set 2 years. It doesn't close off. They do give you a little bit of a grace period. However, if you do not have a residency program, they close your sponsoring institution. You have to wait an additional 2 years from that point before you can apply for a sponsoring institution again. So if you do not develop a program within a 2.5 year period, it would be actually an additional 2 years beyond that you would start the application process again. So that is about the 2 years. And then just one comment, the May 12th date has closed. The next date is in July. And then Song Brown has, and I can't say for 100% sure that they're going to have money or they're not going to have money, but I do a lot of grant writing. Song Brown is one that I do a significant amount of work with. There is indication that the funding is not going to be at the same levels as in previous years, and the planning and development grant may not be there as significantly as it has been in the past. Is that a guarantee? No, I don't know that for sure, but those are the comments that I'm hearing in the field. So I'd like to talk a bit now about the feasibility study. I am the one that wrote that feasibility study, and I'd like to put a little bit of context on that study. I was asked for the feasibility of whether or not the healthcare district could qualify to be a sponsoring institution. And there have been a lot of things that have changed in 2 years in medical education as well as with the community. And in my decision, my recommendation was to the board that the healthcare district could be a sponsoring institution, not whether or not it would be the best option for moving forward as a sponsoring institution. So I just wanted to clarify what my recommendation to this board a year ago was. Since that time, we have made some significant changes and progress toward residency education. The Eastern Riverside and Imperial County Collaborative for Medical Education, we abbreviate that as ERIC, has emerged as a coordinated community-led initiative to address the severe physician shortage in the region. It's led by community organizations that bring together academic institutions, federally qualified healthcare centers, hospitals, and local stakeholders and community partners.
Excuse me, Carmela, can you just please wrap it up to your points? You get 5 minutes and we've gone just a little bit over that 5 minutes.
Yes, ma'am. We have received significant federal and philanthropic federal funding for this to be over $3 million to support the development of this residency program. We have submitted our application for a sponsoring institution, not just the letter of intent. We have confirmation that it will be reviewed at the May 12th meeting. I do anticipate that that will be approved and we will receive initial accreditation at that time. And just in closing, I do believe that the healthcare district's move to become a sponsoring institution will be in competition with this community collaborative. I do not think it will be an enhancement. I do think that by having both sponsoring institutions in place, neither will be successful. And I just thank you for your time.
Good point. Thank you. Go ahead, Chris.
If I may, so the sponsoring institution that you're talking about with the FQHC, does that cover the entire healthcare district geographically, or is it more specific to the specific Eastern Valley and Imperial County? That's one question. And then the other is as kind of an overarching organization, as the district would be for the entire district boundaries geographically, couldn't the healthcare district work with, say, the FQHC to help support their program that they would develop as a residency program without the sponsoring institution component?
Can I talk?
So the question to you, yeah.
Question to the consultant?
Yes, please.
Okay, so I think I remember both of the questions. So yes, it is the entire East Coachella Valley that would be in the realm of possibility. Can you repeat your second question, please?
I'm sorry, Carmela, Chris's question was whether it's the entire Coachella Valley, not just, is it limited only to Eastern? Or
No, it
the
is the entire
Okay.
Coachella Valley. Yeah.
That was question number one.
Okay. Sorry, Chris, can you repeat your question too?
So the work that Intercare would be doing would be serving the entire Coachella Valley?
Yes,
Or the
sir.
Eastern Coachella Valley?
The entire Coachella Valley, sir.
Okay. The second question, what was my second question?
Had something to
We can
about the
work in
sponsoring.
partnership.
If they would,
Yeah, if the district was the overarching sponsoring institution, then we would be able to work with multiple organizations, including the FQHC with their program and helping oversight with that program as well as others, instead of just the one program that the FQHC would be building out.
We're not just building out one program, sir. We are working with multiple partners, and so it will be multiple programs under the sponsoring institution. I think if you're asking for my expert opinion as to what is the best option, I think that the sponsoring institution through Intercare has built a collaborative unit that is already moving forward residency education very successfully.
And my question is would a sponsoring institution sponsored by the district be able to work with other FQHCs in the valley with providing residency care? Yeah. And, we just heard that we have a critical physician shortage in our valley. And this application, just the letter that we sent in only asked one question, would we be eligible to sponsor one? That was it. And it was actually brought by Desert Physicians Medical Group, correct?
Yeah, I mean, it's because there has to be a DIO that's part of that letter of interest. And so Dr. Tae Kim was the DIO that was part of that application. So and just to reiterate, the application for accreditation doesn't require us to commit to all the dollars and the infrastructure that you're concerned about. And I understand that concern, and that's future discussions that will be part of our strategic planning and determining going forward. This was just to give us the opportunity to know if an application for accreditation can be approved for the healthcare district, giving us that opportunity to consider going forward. We don't have to do anything with it if the board chooses not to. going into strategic planning. It's just giving us opportunity to consider it.
I'm just not like completely sold on the, we don't have to do anything, let's just kind of see. Right, I'm speaking for myself, not sure where colleagues stand. Listening to the consultant, who's the one that worked on our feasibility studies, I get that almost reassuring that we're not ready yet. I'm not sure if we're gonna continue discussing this item. This is just information. I know that the next item, if I'm not mistaken, that's the actual action item.
Now that this is all in one, we're just looking for direction, no action.
That there's no action. And I think that all we're doing in terms of giving direction is to answer all the questions that we brought forward to our next meeting to answer those concerns that we've heard.
Is this something that we want to focus on now? Because I know a year ago or 2 years ago, we had stated that we were gonna wait. I feel, well, for me, I feel like we're rushing into something that we're not gonna be prepared for. There's a lot of transitions coming in with the new lease, with everything that's going on, that we're not looking at those transitions that are probably gonna take time also from the staff for them to invest their time and do stuff. But for me, for myself, I think that we should put it on hold.
I think that looking at 2 years down the road to get started on something. I mean, if you think that we have a critical physicians shortage, that this is just one step forward. And this will take 2 years to come to a decision.
And I understand it, see where you're coming from, but then we can't even give like actual answers on like, we did put some numbers up, but like what are direct benefits? Are we gonna be competing? As it is, we already do support these type of programs. We've supported it financially, so it's not like we're not doing anything on it. We already do support those kinds of programs, so can we continue doing that? Is that something that we'll wanna do in the future? I just think that we're not there, and I agree with Director Perez that we should maybe put this on hold. Either if it's the board desires, we can assign staff, maybe we can look for a consultant that can actually help us, guide us through this. Or we can wait until after our new strategic plan. We can maybe, if this is the direction that we want to go in, we can discuss it as we're working on our new strategic plan, which we still have another like year and a half before that one ends. So we're still in one. Or if the board desires, we ask staff to just continue working on it, maybe run it through our strategic plan committee, maybe our programs, or if we just an ad hoc committee to work on this. I think that this just needs a little bit more developing before I'd be okay with moving forward.
So, when I initially heard about this, both from Chris and Carol, I was really supportive. I can see the benefit of the district doing it. However, as I've done a little bit more research, I've been approached by more than one organization in the past few days about what the cost of doing this is, about the complexity of it. I agree with Letty that I think it's a little premature as I start to look at this more, and that even if you consider a 2-year time frame, is that what if we changed our strategic planning and it doesn't fit within that? I can see that it could. Also, though, to Kimberly's point, to the consultant's point, is that there are other organizations that have formed a coalition and are looking into doing this. I think it would behoove us to Director Garza's point, is to maybe have an ad hoc and consult with and see what those organizations have already done, and possibly discuss the benefits of the district possibly being an umbrella organization that they might buy onto. I just don't think we're ready right now to do the application. I could see where we would be in a year or two, but I don't think at this point. I will be honest, as someone who's working very closely in government grants around healthcare right now, I'm not confident in especially state funding, and more importantly, with federal cuts that are most definitely going to come is what is the state gonna have to cut in order to make up for those federal cuts? So I think there are so many unknowns right now. Again, I'm really looking forward to the strategic planning part that we will do as a district. I totally see this fitting within that. I also too don't want us to do something that is going to bring ill will from other organizations that we want to partner with and already have. For the sake of just doing something to do something. So I would agree with Director Perez-Gil that I think we should postpone this until at least and have those discussions within our strategic planning process. And then actually, I wouldn't mind if we started some of those ad hoc conversations with the coalition that's already formed around this as well.
Yeah, my take on direction to staff was not to apply for the application itself, but to come back with more information. So to your point, would you be open to a 3-person ad hoc committee to look at this and come back with more information?
I am not supportive of the idea of an ad hoc committee because I don't think that we should be moving ahead of the strategic plan. I think we have a process that we've already decided on a couple of meetings ago, that we should make sure that we have a plan for the strategic plan and that we are prepared to listen, to come with ideas, and then to adopt the strategic plan that will take us 5 years or whatever it is. If at that time, once we have a strategic plan, if this fits into that, then by all means, we should do it. But why are we in such a hurry to do this when it's not part of what we're doing right now?
And to your comment, it's not a rush thing. This was intended to give us additional information going into the strategic planning process. I'm not coming to you and saying that we have to do this. We don't have to invest all that money into a future program. It allows us, by doing the application for accreditation, only tells us, like the consultant said, whether, because just the letter of intent doesn't say if we're approved to do a sponsoring institution. It just says that we're okay to apply for accreditation. We don't have to commit to any money getting that approval. So when you're talking about all this huge expense, I'm not asking the board to make a decision on that right now. And that doesn't have to happen just by doing the accreditation application.
But we
What that does is,
But we understand that approve us, they'll give us the 2 years, and then if we're not successful within those 2 years, we would have to wait 2 years before we reapply.
that's if you accept the approval. You don't have to accept the.
Yeah, we don't have.
But we would know going into our strategic planning, if it's something that the board chooses to do. If they choose not to do, that's fine. But at least you know about it going into planning.
Poll each other so we can move
Can I
forward.
add one more thing about the reason why I think I would be supportive of an ad hoc committee? I think it was 2 meetings ago, I reported about a meeting that Chris and I attended that we were invited to. Okay, and so if Chris, I believe there was some questions from Desert Care Network. Michelle asked, why were we not invited? And later on, he told me it was a misunderstanding. We were invited. We will start participating. So if there's a need to know what's going on with this effort, we already are at the table. I anticipate that Chris would be part of whatever community conversations are happening, and he'll still be a lot more wealthier with information when the time comes. So we're not gonna just stop. He's gonna continue to listen and learn and decide when the time comes during the strategic plan, he's gonna share that information with us. So we don't need to create another ad hoc committee to know what's going on in that effort.
So Letty, I agree with you. And that's exactly what I was just gonna say is that because there already is the forum that we can participate in, especially with everybody's schedules. I don't get another committee to.
And I kind of, yeah, I mean.
Well,
we-
she
we don't-
said that we would be in competition
Yeah.
with the one that's already set.
That's
So
why I still
are
think
we
there needs to be
doubling?
discussions within
Yeah.
that coalition.
And why even go the whole way if it's something that we're not decided on doing.
I think the direction has been given.
I think direction has been given, but I haven't heard from Director Short.
You might not want.
I'm just listening. I'm just listening to the byway. If we recall, I started by committing myself to the concept of collegial work and education, and yet I'm listening to my colleagues who are talking more about process. And in the context of process, Letty makes the most cogent argument that the strategic planning process, which is on the horizon, should basically become the guidepost against which we judge this proposal and all other proposals. So with that, I decided not to say very much. Thank you.
Well, what we've accomplished is we know that if we want to, we can become a sponsoring institution.
Well, we don't know that for sure. I mean, as the consultant for Intercare said, that the letter of interest gives us the opportunity to do the application, but we haven't been approved.
That's
yet.
what I
So
meant.
that was all I was asking
Okay.
for. And
Well, it's-
we're at the, the behest of the directors. So,
Sounds like we need to move on.
yeah,
So excuse me, what was the direction for the record?
There's no direction.
Put it on.
table.
Put it on hold. And just
There's consensus that we're not moving forward.
At this time.
That's good.
Okay, let's move on to item B,
Okay.
Mutual Broadcasting System Consulting Service.
Yeah, so as the board is aware, we completed the summit that we did last year for the Environmental Health Summit. And out of that was determined that with our communications marketing department, that we'd like to do podcasts and keep that discussion alive. So we've started the podcast process, but we've needed some external help with that. So I did a consulting services agreement with Mutual Broadcasting System, who helps with Will and putting together the podcasts. I think you've seen a couple of them or heard a couple of them already. And so they're $125 per podcast for the audio version. And then at some point, if we do video versions, they'll be $150. So that's an informational item that that agreement was executed by the CEO, was reviewed and approved by legal counsel.
Thank you. Any questions, any comments? Receive letter of support.
In the packet is a letter of support that the district submitted in favor of the Assembly Bill 259, which is requesting the sunset elimination for the modified Brown Act meeting procedures, which for the virtual requirements for public meetings that was set to expire or is set to expire in January 26th. So this is supporting that bill that would eliminate that sunset date. Just an informational item.
Okay, I know this already got sent, but I just want to state that I am not supportive of this. And the reason why I'm not supportive of this is earlier today, Director Barraza and I were at a special district workshop. And I kind of suspected this, but it was good timing that I asked, there was a couple of questions that were asked about this, and I just wanted to clarify that we can continue to join remotely as board members, so long as we comply with noticing the location that we're at and making sure that it's noticed properly 72 hours in advance, and to open up that location to the public if public chooses to attend. So I think that is fine and so long as we have the majority of the board in the service district. So if a board member is not able to attend, but he or she knows that they're not able to be here, and provides that information and is okay with inviting the public to their home, then I think that's enough. It's really, it's fine. I think that as a board member, I understood the responsibilities that I was taking on when I decided to run for this position. I knew that I was going to have to attend meetings and that I was gonna have to be accessible to the public. And so, but I also know that sometimes I might go on vacation. And if I'm on vacation, that I have the opportunity to join remotely to ensure that I am still informed and that I can still participate. So I think that provides enough flexibility. I know this is kind of after the fact, this has already been sent, but just so that you know that, again, this was reiterated at the workshop earlier today, that the board can function with the rules that used to be in place before. And now that COVID is, even though it's still here, but we can manage around it, we have the responsibility to still be accessible to the public, and we can do that by the old rules, so long as we follow the rules. So I'm not in favor of continuing to extend the COVID, special exceptions. If once they expire, I'm fine with it.
Perhaps legal counsel could give us some highlight on what does the actual sunset date do? Does it eliminate then some of the options about virtual attendance?
Well, it's always a good meeting when the lawyer has little to say. But, on this point, I will say that all this bill does is extend the current law beyond 2026. And what we found after COVID was that there are circumstances where you may be sick, you may have a family member that becomes ill and you need to be there. And this simply allows 2 times a year. It's not something you get to do a lot, but it just gives you that situation of where it comes up. Because remember, we publish for the meetings, we publish on Friday, and things could happen over the weekend. So this gave, a little bit of flexibility if you have a family member or if you get sick over the weekend or something like that, and you don't want to infect all your colleagues. So that's all this does. And this bill, as I think I reported on it before, it doesn't change anything. Okay, it simply says it extends the dateline. And so we'll see what happens. I mean, I think that the overall consensus is to allow a little more flexibility, particularly since we've moved away more and more, or moved towards the Zoom meetings. So I think you're going to probably see this, probably be extended. It's not I don't know that there's.
One thing that we learned, one more thing that we learned, I just want to share this because I want to, it was good information, really good workshop. So thank you for allowing us.
The special districts leadership
Special
capacity.
district workshop.
Leadership
Yeah.
capacity.
That if a board member joins remotely, that board member has to be shown on camera. That's what the attorney said. So I'm sure, being an attorney, you probably.
Yeah, I mean, that.
Just keep that in mind when we.
Yeah, whereas the other rule that you were talking about, but the other rule that you're talking about is if you don't have to, the old rules were you could just call in. Okay, you don't have to be on the video. I think under this rule, you have to be on the video, but you just, dial it in. So I don't want to take any more time.
Any other comments? Well, I have a question. Who approved the letter of intent, like these letters of support? Do we all approve them to get sent, or do you approve them, or the president? Yes.
Well, typically, if there's a request that comes from a director, I'll run by with legal counsel, the letter it's a letter for, the Assembly Member Rubio. to support the extension of that date or the elimination of that date. So then it was submitted. I mean, there's a timeline to it, and then and traditionally, that's what we've done is, CEO works with the legal counsel, and that comes as a request from a director or more, and we provide it, and then it's published here for transparency purposes.
But we
A
could,
director or more? Is it one director or is it more than one director?
In this instance, it was one director, and then I went through, approved with legal counsel and submitted.
but I think you bring up a good point. I mean, if you want in the future, before we decide to sponsor anything, to have it come to you first, we can do that. The challenge sometimes is a timing issue, because you may want to support something collectively and you miss that date. But I mean, I think it's up to you. I mean, these are all good points that ultimately you have to decide whether or not you want to support legislation or you would prefer to have it come to the board first. And I think we could do that.
I think we have a legislative committee now. And we should go use that committee to be able to give us their feedback, especially the people that are serving have a lot of good knowledge of the process. And in this case, I just needed to share my comments because I understand that what the CEO has to do is based on he has to act on timing. If it's something that he has to act on, he has to use his decision-making on, is this something that the board has acted on in favor of in the past? And if it's something that he thinks that's gonna be passed again, he's gonna act on it. If it's something that he can wait, then he's gonna probably wanna bring it back to the legislative committee, go through the process. But that's a good point, is just to be able to bring that awareness to the rest of us, to remind us about how this was done. If there is a time issue, I think the CEO has to act on it, but otherwise.
Well, we've got another good case in point right now with the SB 588 for the freestanding emergency department. We've got very tight timeline with that. Be able to bring all the letters of support, and we have several of them in the packet that have already been submitted. But I mean, if you want them to come to the board, we're going to miss deadlines. So your point, I think the CEO has to make some decisions.
That's another example of what we just spent maybe like a half an hour talking about the school or whatever the transition. This program, we sent a letter of support, or we worked with Ochoa on that letter of intent without thinking. I feel like we didn't think about it twice. Now we're on a time crunch, like how you say, we have to submit these letters, we have to submit all that. And it's just like, I'm feeling like I'm getting sideswiped with both of them. Like all of a sudden I'm getting them put here and it's like, that's what we're doing. I feel like.
I think the board has to decide, what they want the CEO to do. If they want the CEO to respond to these types of things in the legislative committee, I can't have all three of the committee members, unfortunately, going back and forth with communications, but we've had some pretty intense discussion and deadlines that we've been having to deal with getting these letters of support for the SB 588. So I really think that the board needs to determine collectively if they want the CEO to continue with this type of process that we have, or if we want to bring those letters of support to the board before we approve them. We are going to have some issues where we miss some deadlines. So I think that's a critical piece of information is deadlines.
Thank you, Chris.
Director Barraza.
And I appreciate that you're asking for direction. Let's look into other agencies. So I can tell you some cities, there's no right or wrong. I've seen cities in other special districts that will not issue a letter of support until it's been approved by the full board. that does limit, you know, our CEO to be able, like you just mentioned, there's some times where we just need to submit a letter of support or express our support. So how about, can you look at what other districts are doing and propose something? I'm not sure if we want to run it through our policy committee, run something that would work. We just establish our legislative committee. Let's see what's going to work. Let's not, I don't want to like, I don't want to cry over spilled milk, but let's just make sure that moving forward, we'll be able to have something in place that we're all okay. I know that we might not all agree on it, but let's create some policy that will give you the guidance and the direction and instructions on how to proceed, because it's not fair to you for us to be telling you, go do this, and then we make comments where like, why did you do this?
Yeah, and it gets more complicated because sometimes you'll be asked as a member of the board of directors to support particular projects or legislation. They'll come to you and they say, we'd like you to sign this or whatever. And then you're, you know, as a member of the board, I'm not authorized on behalf of the board to do this. So am I doing this as an individual? So this gets a little tricky. And I do think that's a good suggestion. We can come back and say, here's some examples of things we could do that I think would help address it. I do think what Greg, you know, what you said about having a legislative committee look at these things, even though they may only meet once a month, there may be some ability to you know, get a head start on
Special,
stuff.
And I'll add as well, within our organizational chart, we do have a position for a legislative analyst. This is something that might be beneficial to you, Chris, where you're not necessarily the one focusing. Typically, and I guess maybe we can talk about that within our next item I1, where it's not, typically it's not a sponsor's or special district's duty to collect letters of support. We're doing it because it's a bill that we're sponsoring and it's just a smart thing to do. But typically this falls on the legislator's office. I haven't had a direct conversation with them. I've gotten some updates, but I wouldn't be able to tell you this is what the senator's office is doing. We do have updates from our lobbyists, but typically, I guess, like, to reassure you a little, typically this is not going to be the work that we're going to be doing. We're not going to necessarily be outreaching, asking for letters of support. I think it was important for us to do this because it's a district or district sponsored bill. But typically we won't see like this much work going into piece of legislation unless, right, if this is passed in the future and then we work on another bill to actually get, you know, a license for it. But yeah.
Director Long.
Okay, I think we've gotten way off the agenda item.
Yeah.
So if we could just bring that up as something that to address when it goes through the legislative, and there's a lot of steps. But I don't want you to think, Chris, that what you're in the process of doing is putting you out there like, oh God, they're not giving me any direction. What I said before is that when the CEO has the authority to act on the board's, you know, action or what he thinks the board is going to say, you've already started doing this. Why would we backtrack? Why would we change direction?
Well, it sounds like that's.
So I just wanted to clarify that, but just, that was it, is that please continue, Madam President.
Not on you.
Just consensus to please continue with the process he already started, to not let him wonder, oh my God, what am I doing now?
But didn't I just hear that we're bringing it to like policies committee to determine?
Future items, how do we address future letters of support, legislation? That's what we have a committee for. Let's create a description of what is the committee supposed to be doing, how the process.
Or even just the guidelines for it.
Yeah,
So
exactly.
basically, if it fits within the strategic plan of the district, you should have the authority to defend those out.
Or if it's being directed by
a meeting. Right.
Because that I think is the.
But we don't want to put too many hamstrings on them because then
It should have been emphasized that the committee had given authorization and discussed this already about doing. So it's just frustrating to me to hear then that, okay, we got to go to develop a policy at the policies
I mean, I think we
Policy
should though.
committee.
We just created a new committee. I don't see why we wouldn't create policies that guide us how to go about the committee.
But I think,
But guidelines.
because I think
or-
it'll give you more flexibility and just, and it gives you more flexibility. It's just outlined. You're gonna be saying, okay, I met with them.
Yeah, which I thought we already had, so
And
we'll.
the board acted on that item previously at last month's meeting, Chris. We acted on to support that legislation, so
No,
this is
exactly.
nothing new.
Exactly.
Okay, sorry for.
And please be reminded that individual directors can write letters of support for
As individuals.
as individuals. Yes.
That's,
I'd like to remind the board that many years ago, I testified before the Senate Health Committee to expand the district to the east when I was one of 4 members that were for it. As an individual. Okay. Item D.
The CEO engagements and district media visibility, information is in the packet. You have any questions or comments?
Any questions or comments? Okay. Moving on to legal.
So Mark Twain is with us here with all the flux in Congress, once said that no individual's life, liberty, or property is safe while the legislature is in session. So I kind of feel like it these days. The only thing I had is just one quick little bill that I ran across was related to healthcare districts in northern San Diego County. And there's a lot of stress going on, particularly at Palomar. They have a huge debt and they've got some real financial challenges, to say the least, and are on the verge of bankruptcy, and they haven't been talking to their legislators. And so there's the bill that's been spun out that would require the Department of Healthcare Access and Information to convene a working group to study and make recommendations regarding the provision of healthcare service in healthcare districts in the northern region of San Diego County. It's kind of like what was happening over in Imperial with all the stuff that was going on. And I don't think this bill's going anywhere, but I just thought it would be worthwhile just to provide the information to you so that you kind of had an idea. And it's kind of, you know, it encompasses Fallbrook and Tri-City and Palomar and you know, it highlights that they want to have a delegation of legislators. And so they're going to review and discuss statutory or other responsibilities of each of the healthcare districts and kind of get into it. Now, whether or not this even gets through committee, it remains to be seen, but there's some big financial challenges that are going on in San Diego County. And everybody's trying to affiliate with somebody because the days of the freestanding acute care hospital are just, it's really tough right now. You need to be part of a system. Thank you.
Anybody mind if we took a 5-minute break to grab a dinner and
But we haven't finished the district. Did you still want to take it again? I'm sorry, we have not concluded the district. Did you still want to move forward with the break? We haven't adjourned the district yet. The committees and then we.
I have an urgent bathroom request.
Okay. Well, that's President's prerogative.
Being 82 years old.
Now let's stop having to go. Ain't got nothing to do with it.
Hey, man,
Thank you.
Legislative Policy Committee. Raja?
Yes, so the bill, once again, for the meeting minutes and fact sheet and letters of support are in the agenda. I'll be happy to answer any questions. Right before, I'm gonna give you a quick recap. Again, the bill is, asking the state to conduct a feasibility study on emergency, freestanding emergency departments. The bill will be heard in committee hearing on the 30th. We do have two witnesses that will be in support. One will be a local doctor. The other will be, if I'm not mistaken, a CO representative of a healthcare district within Northern California area. And that's so that we can have it be balanced, both from NorCal and SoCal. Bad news, but it was anticipated. There will be testimony and opposition. So we are already facing some opposition. At this time, I do not believe that it's necessary that it's needed, it's necessary for representatives of the health district to attend the hearing. It'll be something quick and we won't have a lot of time to go speak to legislators. We're talking about just a smaller group that sits within that committee. I believe it's maybe like 10 legislators. So if this bill passes the committee, I would recommend that then we send a delegation to go meet with a broader body, which would be the whole Senate and eventually the Assembly. But stay tuned. The hearing will be live streamed. We can send that information, the link around if you want to see it. And so crossing our fingers, hoping that it will pass the health committee. And so if not, it could die and it could just be the end of it. But we'll find out next week.
And item 6 on the agenda of many items, so starts at 1:30 on the 30th.
They usually do go in order, but they might like jump around. So yeah, you might be on the computer for a little while.
And it's so great to have Director Barraza as chairman of the committee who knows the ins and outs of getting legislation passed and has made some really good suggestions.
And our witness for testimony from here is ER director at JFK. Who's got great credentials. He's worked with, currently still works with some FEDs in, I think, New Mexico, I think it is, so.
And we have two major physician groups, emergency room physician groups have written letter of support for the bill. We understand that there is an emergency room physician organization within the state of California that's opposing it. So hopefully the physician groups that we have that are testifying will help us get it passed.
Is that, sorry,
Go ahead.
is that the one that you just mentioned that is opposing it? Is that the one that is indicated?
They're sending a witness building.
And do you know why? What were their main points?
It wasn't shared with us. I know that in the past they have. We know that we've had opposition from the hospital association. We've had, or in previous attempts, and also opposition from labor. So I did ask our lobbyists to find out and to try to set up meetings so that we can get, in front of them and find out what it is that they're in opposition. I haven't seen that information shared, but I guess we'll find out next Tuesday.
Actually, it's just a feasibility study, not,
Yeah, but I mean.
that it could lead to something.
That's the main, I
They'd
mean,
rather
because
skip
I
it
see
early.
it, right, because I see it, it's like a feasibility, and then we have the information, and if it tells us that it is feasible, that the next step is gonna.
Yeah, they'd rather
Right.
kill it early than.
It could be.
And we do have several letters of support, especially from health institutions, organizations. Unfortunately, efforts with Eisenhower Health, they were not willing to provide a letter of support for taking a wait and see approach and potentially respond later if it proceeds.
Right, on to Finance, Legal, Administration, Real Estate Committee.
You're gonna handle that, go ahead.
Okay, so we have the minutes that are there for you to comment if you have any comments or questions. Are there any? No? Then we have our district investment report. Is there any questions or comments? Then we have the Regional Government Services Authority, the consulting services agreement. This was came to the committee for a $35,000 increase to complete a classification and total compensation study analysis. However, there was consensus from, I think this was shared in our minutes, that there was consensus to table this part so that we could get feedback from the board. The comment that was shared and that was the consensus of the committee was, is that something that's really necessary at this time? That in the past, we've had comparison study when there seems to be a lot of turnover. And that's not the case. I think we have a lot of staff that has been for a while. So we don't think that that's something that's necessary at this time. But so that's not included in the motion, right? Chris, it was just to get feedback.
I mean, it is an action item to consider whether we're going to take the recommendation of the committee to table. But it was recommended that the board have opportunity to weigh in on it and give their feedback. And you know, from the staff's perspective, you know, we have not, I've been here 10 plus years, and we have not had a full classification and compensation study done. And to Director Delara's point, you know, we have had great retention. And I think we've got, you know, good compensation programs in that, but we don't know, as we especially go into our annual budgeting process each year. And, you know, because of our employee retention and our proposed 5% merit increases in that, we want to feel confident that the salary ranges that we have for each of our current positions are good, justified salary ranges, compensation, and considering the entire compensation package. Because we have, you know, the good benefits, insurances, et cetera, things like that. And so we want to also have a baseline with that, with our current staffing. Also, as we recruit for filling positions, we have accounting manager position that we have open that we're looking to fill. And also, as we're moving forward in our strategic planning process, there's potential that there could be increased staffing needs. So we could add to that and do that additional work at that point in time. But staff feels it's important to do this now. And it's also recommended by our HR firm. If you consider we had the assessment that was done by the HR firm, this was one of the items that they highlighted as a recommendation to complete. They didn't give a dead timeline to that, but they do feel that it's important for us to have it. And also then with the new services agreement that we're working with RGS services that, you know, so staff is recommending that we continue with that option now. Also noting the recommendation from the committee to table it until we get through the strategic planning process.
So, President, just so that we are clear in this, in that when I brought up I was still trying to decide what way to go in. Actually, I decided to not support this after I heard from RGS when she said it's not really necessary if you don't think that it's not going to hurt you not to do it at this time. You could postpone to do this at a later time. My understanding is when you've created so many positions recently, I think maybe half of your staff, that you did do an analysis of when you created a job description, and that you must have done some analysis of what the salary range was. So I don't think that will in any way hinder you to be able to continue to seek talent that is attracted to the salary ranges and the the benefits that we have. I think there seems to be, just based on, again, this is just from the outside looking in, there doesn't seem to be any concern about, we see the salaries every year when we go into budget. There doesn't seem to be any concern about losing staff because there's better opportunities in terms of pay and benefits. So I decided that there's no need to do this right now. And so that's how I would, based on what the consultant said during that meeting, I was going to support it before we had that conversation, but after hearing and having this conversation, I'm not in favor of adding the $35,000 at this time. That's the action item. And before we take that as an action item, I'll turn it back over to the president. But on D, is there any questions on D, questions or comments? No? Okay, so I'll turn it back over to our president.
I'd like to comment
Go ahead.
on this. I'm not so much concerned about, given the level of stability that we have, that really mutes my concern for moving forward, but I am concerned looking forward to the impact of what's going on in our country today in terms of the economic upheavals and uncertainty about impact of inflation as you anticipate budget building. And my question is, what's the deadline, roughly speaking, what's your deadline for having input to properly evaluate an issue relative to inflation, as an example, as it would affect the payroll? You have, when do you need that information relative to staying on your trajectory to get your budget done properly?
Well, we will be submitting the draft annual budget at next month's finance committee. Now, I don't know that we're going to have that kind of information to know what inflation and that type of thing will do for budget purposes. So that's something that's going to have to be maybe considered throughout the year after that.
So it's
we can put a factor in, but it's not going to have any real justification.
It's not tomorrow, it's the end.
Right, but more of my concern with now, and I agree with you, there's stability in the staffing in that, but also keeping in mind that when we come with the annual budget for review, there's most every position is requiring, if we're to consider 5%, up to 5% merit increases for staff, we are already at the upper limit on the salary ranges. And so we were looking maybe to be able to incorporate some of this process to help us. We may not have the study completely done in order to present the budget, but also to be able to help guide us. Are we justified in increasing those salary ranges? And if we're okay with continuing without doing the study, that's okay. But just want, those that are on the F&A committee to kind of understand that that's kind of where we're at. So we just wanted to complete a study that gives us that confidence as a district in how we're managing our pay plan, and that there's no concerns or issues with that.
When would you get the study completed? By what date?
If this was approved tonight, we could have it done. I think it's a 6 to 8 week process. So we wouldn't have it 100% completed for the first round of review of the budget. But I think we could get some indicators to understand if we have support there.
Director Rodriguez and Director Zulora.
So I appreciate the comment that there's not staff turnover. I don't always think that's a good indication of what staff salary should be. However, I do think that as we go through strategic planning over the next year, we're going to know what type of other positions there might be. And I think it would make more sense then to do an analysis. This is quite a hefty, you're only talking 6 to 8 weeks at $60,000. That's $10,000 a week. I know consultants are expensive.
$36,000 to do.
It's 6 weeks.
It increases the current, because we've agreed with them to work with us on other items.
Okay.
But this specific component is 36.
Our original contract was 25K, and then with this additional,
It increases it to 60.
Okay. Director Delora.
So there's 2 points that I want to address. One is you, Director Shore brought up the inflation thing. Didn't we address that a few years ago when, that you actually did create some kind of a factor of when it does get really high that we have to actually, so that it's not every year, but rather when it hits some kind of a level. So that was one thing. The other thing is, if you are in the marketplace, then you know that your salary is going to be going up. If you are producing based on, but we're a special district. Okay, and so therefore, we have the expectation that benefits are going to somehow be able to incentivize a person, an employee. I know when I was in government, the question was, oh my gosh, if you were out working in the private sector, you would get a lot more money. But what you get instead of the high pay, you get the incentives, you get the benefits. So I think when I said before that what I see based on what the information that you share with us every year is that the salaries and the benefits are, I think, are good, okay? And what we asked the consultant is, could we do this like later on when we are looking at increasing staff and looking at what is the plan for the staffing? Because if you bring in a staff person at a new position and that person is making a lot more money than a person who's been with the district 10 years, that's going to be really difficult to be able to justify that. There's going to be like, why is he or she getting paid more? So you're going to need a study as you are looking at adding more team members. But I think what we decided that day was, can we just postpone this for, after we do the strategic planning and we know what is the build out, then we probably do need to have a wage analysis study to be able to justify where we're bringing in other people into the organization that has employees that have been here 10 plus years. But it hasn't been because of wages and benefits. It's been about how do you integrate where you're going to the people, to value the people that you have had for all these years. So that was the idea. I thank you for reminding me.
Thank you. May I have either a motion to table or a motion to approve or a motion to deny?
Motion to deny.
Second.
Roll call,
Well,
please.
it's denying a table or is it?
To not increase by 35,000.
Right.
To postpone it until a later date.
Is that what
Well,
I'm saying? Is that the same as tabling?
I think it's different.
It's different than tabling?
making a decision on it.
You're
Yeah,
making a hard
we'll
decision-
deny it,
Making
but
a
then
hard
The
decision.
direction would be to staff is to bring it back.
Bring it
once
back,
the-
okay. but
After the
that's-
strategic planning. After.
I think that denying the action item and then reinforcing the committee's direction to table for a later date.
So after strategic planning.
Okay.
So again, I'm confused. Is it a motion to table?
No.
To deny.
Motion to deny with the inference to
Come back.
give them the opportunity to come back as they see fit. That's fine.
All
I
right.
understand. Thank you.
Roll call, please.
Director Foresthill? No. Director Shore?
No.
No.
Hold on, you're.
Well, it's already go.
Even though you made a
need to
motion to
vote
support
yes
it
to
moving
deny.
Let's start again.
Okay.
I'm confused too, because you guys said first that we vote no now, but then we're tabling it until after
A yes vote?
Vote no to
A
increase
yes
it
vote
at this
is
time.
a denial.
Some voting no, is that correct?
No,
If
so
you want-
the motion is to deny, so
The
you,
motion is to
so you
deny.
want to vote yes to deny.
Well, yeah, excuse me. Thank you very much for the clarification.
It's like a ballot proposition.
I vote to deny.
Yeah.
Yes.
Director Foresthill? Yes. Director Delaro,
Yes.
Director Raza,
Yes.
Vice President Rodriguez, and President Rogers.
Yeah.
I'd like to thank my colleagues for educating me properly. Thank you.
Great. Okay, where are we? Program committee?
The draft meeting minutes
Right.
are in the packet. Does anyone have any questions regarding the draft meeting minutes from April 10th? On to the next one, B, progress and financial reports update. They're also located in the packet. Does anyone have any questions regarding the information provided? We'll move on to grant application status report. That was also in the packet. Does anyone have any questions regarding?
I have a question about one of the mini grants that was denied. The organization asked if is it possible to resubmit the application to see if it would better align with the district policy. Is that possible?
Anybody can.
They can resubmit.
Be a new grant application.
A new grant application, and if they do that, will they be able to get staff support to help them with their?
They're asking.
Are
there any other questions regarding? Move on to grant payment schedule. Is there any questions regarding the grant payment schedule included in the packet? Okay.
Yeah. Item J, board member comments?
I do have a comment, is that, unfortunately, I did mention to Andrea that I'm not gonna be able to attend the strategic planning and the finance accounting meetings in May, because of another obligation. So knowing in advance, if there's a possibility of having those meetings as a special meeting on another day or time, another day would be better. But if not, I understand and that's fine, but I will not be able to.
I will be flying on May 8th, but available subsequently if any changes are made.
I don't see any problem with postponing to a later date. Anybody else weigh in on that? Is that there's no restrictions on us changing the meeting
I'll
date?
let staff and for them to contact the other board member. But if you cannot make it happen, that's fine. But I just was wanting to put that out there that I'm not available on that day. Thank you.
And that's on the 13th. So if anybody has issue with
Me too.
from the 13th,
Oh, no, I can
You could attend
make the 13th
remotely.
by Zoom.
But
so we'll reach out to you, but we'll need to look at rescheduling
There's
this.
a possibility to postpone it to accommodate our director's schedules, committee members. But let's try and do that. The only other comment I had was I was reading the minutes and I'm not sure where, is that Director Delar brought up some concern about food bank funding.
Yeah, and so I was informed that I actually missed, I thought the Fine Food Bank telephone was gonna be like the week afterwards, and so I thought maybe we could do something, but I was informed by our team that it was actually had taken place right before. So, but I was curious because of that story in the Desert Sun about our food bank not getting the funding that they were anticipating. So I don't know if you have any more information on that.
But what we were actually going to propose next month, but now that this is brought up, and I guess we could ask for direction, is we were thinking there's roughly 500,000 remaining in the foundation with grant funding that we could apply or award. And so we were talking internally about potentially working with, food banks and other. I don't think we can go directly to, say, Fine Food Bank, but if we put it out as a communication to the general public that you could apply for funding related to, food instability, et cetera, and then we could entertain doing grants related to those funds that are available in the foundation.
So you'll put it on the agenda for next month then?
That sounds great. So the communication to the public would be that we have the X amount of funds to dispense. And would it be just food insecurity, or could we open it up to all of our funding priorities?
I think that's what's gonna be on the agenda is how we
Yeah,
can do it.
we
We
can
can't
really discuss
decide
that,
today.
right?
Yeah, I was gonna say,
Comment.
wait, hold on.
We can't discuss this right. It's on the agenda.
Correct. I mean, our intent would be to bring it as food insecurity, but then the board can entertain how they would like to consider using
That's
those.
my
I
question.
would
Meaning
make
resource.
it like as an initiative, right?
Right.
More
Uh-huh.
than, and then I just wouldn't want us to contradict ourselves where we're prioritizing funding in some other, that align with other strategic goals, and that this one doesn't align. And so then how do we go back into everything? We can't, because we're not aligned, you're not within the high priority goals, and then we're gonna come out over here and say, let's do this. So let's just be, yeah.
And those are things that you as the directors have to consider as you're, making these decisions. It does allow for you to decide if you want to go outside of the high priority strategic goals. We have tried to remain focused to those, but as we know, with current administration issues, we didn't know about when we changed the high priority levels. And that does create some concern for our community, so.
Thank you. Any other board member comment?
May I ask on those committees that you won't be able to attend, is it, can we have other board members serve in that capacity on the committee for that time?
Well, I don't think, do we have a policy on that? I'm not sure we have a policy on that.
I think that we can establish alternates, and if somebody would like an alternate.
It's typical to have the president available sometimes as an alternate, but I don't know that at other districts, we utilize that. But
I'm okay with moving them, because I sit on both of those committees, to a different time or a different date. If we can make it work. If not.
Well, and we'll look to do that. I was just asking if that was consideration.
Okay, well, let's adjourn the district meeting and move on to the foundation meeting. Does anybody